be showing you the procedure for Jal Neti. Jal Neti is a practice to clean your nasal cavity. As we take care by brushing our teeth for the dental hygiene, we should be doing Jal Neti for the nasal hygiene. We can practice Jal Neti once or maximum twice in a week with saline water. So now Dr. Sayogita will show you how do we do it and go about it. We start the Jal Neti practice with one round of Kapalabhati. Active exhalation, passive inhalation. So why do we do Kapalabhati before the practice? Just to clear up our nasal tract and slightly to warm up our body. Do as per your own capacity, do not overdo. So we start. So we need a Jal Neti pot. Make sure you sterilize the pot before and after every use, and please do not share your pot with others. Okay, we have saline water. Why are we using the saline water? Yeah, saline water is lukewarm drinking water. Add a pinch of salt to it. So why salt? Because salt cleans the mucus in the cavity, and the chlorine ion has an antiseptic action. Alright? So, now to begin with, you bend at a 90-degree angle, push your hips slightly back so that there is no pressure on your lower back. Now, first you start breathing with your mouth. Breathe through the mouth, get a rhythmic pattern of your breaths. And now start pouring the water through your one nostril. If you are doing Jal Neti correctly and regularly, it helps to remove the dirt trapped along with the mucus in our nostril. It helps to relieve symptoms of sinusitis, acute allergies, even migraines, and dry cough, and cures asthma. Breathe through the mouth. Do not stop your breaths from the mouth. Maintain that rhythmic pattern. Once you are done from one nostril, you can blow your nose. And we repeat the same procedure from the other nostril. So first, start with the rhythmic mouth breaths and then pour the water through the nostril. Jal Neti not only stimulates the nerve centers but induces harmony and balance in the body and mind and illuminates the divine sight. Blow your nose completely. It is very important to drain out all the trapped water from the nostrils, from the nasal cavities. So blow your nose hard. Fine. nasal cavities completely. Now, who should not be doing it? Someone who has fever, cold, cough, blocked nose or bleeding nose or any kind of ear infection should not be doing should not be doing Jal Neti. So do the Kapalbhati practice. In case you are doing it for the first time, please seek guidance from an expert and then do the Jal Neti practice. So once you are done with Kapalabhati, so if you still feel some water inside, you can stretch back in Shashankasana and stay there so that the remaining water comes out. It's very, very important to make sure that there's no water clogged so that the nostrils are clear. So do it on a regular basis. Stay safe, stay healthy. Thank you. Namaste.